Hi everyone, my name is Dana Brown. This is my presentation on health and illness among military families. The military is long admired for their dedication and service to our country. These are the men and women that sacrifice so much to protect us and our land and keep the United States safe. They're consistently asked to spend little time with their family, are put through rigorous trainings, work long days and hours, and in most cases move frequently to different bases. These men and women are unbelievably hard on their bodies. What is asked of them physically and mentally is more than most of us can ever imagine. It is obvious that this would take a toll on their overall health and how they utilize their medical benefits. This will be explored throughout the following presentation. Here are a few of the major takeaways I hope you guys gather from my presentation. I hope you guys can understand the military healthcare system, be able to understand the most common obstacles military members face in regards to healthcare, and be able to list the most common injuries active duty members face. At this point, I know we all have heard these definitions over and over again. The author Rachel Spector, in our book Cultural Diversity in Health and Illness, goes over these two terms and defines them separately. Health is defined as the balance of a person both within one's being, physical, mental, and spiritual, and in the outside world, natural, communal, and metaphysical. Illness is defined as the imbalance of a person both within one's being, physical, mental, and spiritual, and in the outside world, natural, communal, and metaphysical. These definitions I shared with some people I interviewed, and you'll see later in the slideshow their responses to these definitions. One of my first interviews, and definitely one of my most insightful interviews, was with my stepfather, Earl Skull. I asked him a few different questions, and I said, what do you think about this definition that my author, Rachel Spector, provides for our class? Do you agree with this? And he was number two. He said, what in the hell does that mean? And he said, I think anyone you ask is going to have that same reaction to that definition that Spector provided. He did not agree with it, nor did he think anyone else in the military would as well. But you can see that my first interview, Rick Sturs, in this slide, had the same reaction. Kyle Kinder is a dear friend of mine. He was based here for about 7 months earlier this year after moving here from Jacksonville, Florida. He was a Marine pilot, he still is. He flies Whiskey Cobra helicopters, and during his time here, I really got to know him well, and he helped me understand a lot about the military and what it means to serve and what makes someone sign up for the military. In the time that I knew him, there were a few times he became ill, and ill enough that he should have seen a doctor for prescription antibiotics, and he refused to go. He was worried that he would seem weak or like him being sick was going to prevent him from doing his job, and he refused to go any other time other than his yearly mandatory checkup. And I think this is a problem that not only afflicted Kyle, but something that all Marines face and all military members face as well. So the military healthcare system is actually an insurance program called Trifecta. That is what the military refers to it as. The military healthcare system is run by the Department of Defense. It's available to every person of active duty and post-service and retirement. Its primary mission is to maintain the health of military personnel so they can carry out their military missions and to deliver health care during wartime. I have a friend who's a doctor for the Navy. His name is Ben Smith, and Ben actually was just deployed, got new orders to go to Hawaii, and he has been training at Palms 29 and flying back to Hawaii in order to learn how to treat patients in war zones, and he will be traveling for the next 2 years to the Middle East and to 20 different countries, including Japan, treating soldiers in trauma events. So we have 4 kinds of medical facilities available to military and their families, and they have access to the following. Multi-service markets. There's 15 total across the country. They are a network of hospitals and clinics, and there are doctors there with specialties and subspecialties. The second is going to be medical centers, which is the largest type of medical facility for military. These centers have a lot of specialties. They include things for like oncology, veterinary affairs, so on and so forth. Then they have hospitals, which we are all familiar with at this point. They are there for outpatient or inpatient procedures. And then there are clinics, which to civilians can be referred to as urgent care. So these clinics only offer outpatient treatments. So there are some obstacles in the military healthcare system. One thing that I researched and discovered is that women have a difficult time gaining access to reproductive and sexual health care. Men are offered several other sexual health care opportunities that women in the military are not yet at this point, which is frightening because there are 16% of our armed forces are women. Private plans under the Affordable Care Act cover contraception, yet the military's insurance plan, Trifecta, which I mentioned earlier, requires a copay. which is troubling considering these women should have access to contraception just like civilians should. And in the case of sexual assault within the military, access to emergency contraception, such as the morning after pill, can be difficult to find, and it's kind of a red tape issue that's hard for women to gain access to due to certain levels of the military preventing this. Obviously, these men and women are going to war, and they are fighting our battles and protecting us and putting their lives at risk. And unfortunately, one of the obstacles that these people face is casualties. We lose a lot of men and women, great men and women, every year. This is just an example of some of the statistics due to several operations we have performed, within the last 15 years, and how many service men and women we have lost. Another obstacle we face, which I feel like has kind of become a taboo subject, is PTSD. These men and women see things that we can not even imagine, and that takes a toll on them. And I actually have a good friend who is not in the Marine Corps anymore. He was for several years, and since he has left, he has become a spokesperson for the military on his own accord, not government consented, but he speaks out and talks about issues about Marine suicides and what we can do about it. He does public speakings, and he encourages people to speak about the matter honestly and frankly. And he wrote a book that kind of combined the satire of, the comedic parts of being in the Marines and what happens overseas, but really put it in a very serious tone at the very end of the book. Talked a lot about Marine suicide and what we can do to prevent that. It's an issue that we don't talk about enough. And here you can see the statistics by year of people that are experiencing PTSD after being deployed or in the military currently. Here I thought I would tie in a personal anecdote. I would not consider myself a military family. However, my uncle Bruce was in the Marine Corps, and he has quite the story, and I would like to share a little bit about it. So my uncle served in Vietnam. He did 3 tours. He was exposed to Agent Orange while he was over there. When he returned, he had a combination of post-traumatic stress disorder, as well as having physical damage from the AO. His hands and feet would break out in these horrible blisters for weeks at a time, and he didn't really receive the treatment he needed. Doctors put him on medication, but they didn't actually follow up with him or work on any sort of solution or long-term permanent solution to his issues. Eventually, he sought out help from another doctor, and he was given another antidepressant that unfortunately conflicted with the one that the military doctors had given him, and he had a fatal heart attack as a result. My aunt recalls, nights where he would be just, curled up in a ball in the corner of the room, just rocking back and forth, and that was the toll that the wars took on him, what he saw. But unfortunately, he did not receive any counseling or further treatment for that kind of emotional trauma. So we know that people in the military face a lot of health obstacles as far as they're more prone to injuries just due to the nature of their work, especially the people in the military that actually go to war and are fighting for our country. They're at risk every day for things such as gunshot wounds, brain injuries, and limb amputation. I think something that we overlook in military families is the cost of the children only being with one parent a lot of the time. Through my interviews and just speaking with people over the last couple of years in the military, this is a conclusion I've come to. I moved back to Carlsbad when I moved back to San Diego, and being next to Camp Pendleton, I've actually met a lot of Marines, and just talking to them and figuring out what they go through on a regular basis. They leave their spouse at home for 6 months to a year very often to go to tour, and these women are left at home raising their kids all on their own, and they feel that their children suffer from that, obviously. When they know that they have a parent that wants to be with them but can't, it's hard for younger children to understand, and it definitely puts more responsibility on the wife's shoulders as well. So my stepdad, Earl, he found this presentation to be a little bit entertaining. My questions that I asked him, he had a smirk on his face for most of the questions I asked. He feels, or at least felt, that growing up his childhood was not affected by being in the military. He said that was just those were the times, and that's how parents reacted. Obviously, you can see his quote here. As a kid, we didn't go to the doctor unless our mother thought we were dying. He never sought out health care. His father never sought out health care until the very end of his father's life. And Earl is the same way today. Earl will not go to the doctor unless he's very, very, very sick, and it takes him weeks of being that sick before he'll actually admit he needs to go see a doctor. So I think growing up with a military father influenced him, and then being in the military himself, I think he's going to live out the rest of his days with that same attitude. It definitely shaped him. His dad did not receive counseling after the war, and he definitely had post-traumatic stress disorder. Earl said when he came back, he was a completely different person. He didn't even know who his father was anymore. Even if we offered it to him, Earl did not think that his dad would have gone back then, nor would Earl admit if he would go today. If Earl had actually gone to war and had PTSD, he will not admit if he would go to counseling today. He said that his father didn't want to seem weak, and I think Earl carries the same beliefs. Through my research, I discovered that there are online forums to post discussion boards for military to talk about the pros and cons of military medicine. I think this is a good way for them to express what's really going on without judgment, and really express how they truly feel about military health care and why they choose to accept it or not to accept it. So this group obviously has some high risk factors. Women in the military are at risk for sexual assault. It's something that's been going on for years, and we're all very aware of it. Yet that doesn't change the fact that it's still happening. Men are at risk for not seeking medical attention when ill. Obviously, we talked about that. They don't want to be seen as weak or like they can't perform their job well. In an article I found by Jonathan Landay, hazing and initiations are common in the military. It goes on in all of the services. It goes on in other country services, said David Segal of the University of Maryland Center for Research on Military Organization. It gets people to identify with the organization. The U.S. military has, he says, tried to get control over abusive rights, and those rights involve less sadism than they used to. So obviously we can see here it's still something that's happening. I think we all hold very different opinions on hazing and initiation rituals, but in the next slide you'll see how it can be taken a little too far. In that same article, we hear an account of initiation from a military member, and he says, "We went upstairs in groups of 3. The lights were dimmed. 3 drill sergeants stood in front of us. They hit us pretty much as hard as they could on our chest on top of our service ribbons," Pointer recalls. "The points actually go into your skin." As you can see, I don't think in any organization this should be an acceptable form of hazing or initiation. So Jeremy is the character I've introduced here in this story. Jeremy knows my friend Claire. They met on a dating website, and they've been communicating while he's been deployed overseas. He has confided in Claire that he's witnessed a rape of a female member of the military by a superior, and he didn't step in or report the rape, and he's feeling very guilty about that and having some PTSD symptoms due to that. He's also experiencing a really bad pain in the right side of his back and has ongoing fevers, but doesn't want to get checked out in the boat. He wants to wait till he can get home and see a civilian doctor. He's afraid of what this could be, but he is worried that he would get medically discharged from the Navy if he went and saw a doctor on the ship currently. So I think it's really important that we really understand the military and the significance of their beliefs. Why do they do what they do, and understanding their level of sacrifice and commitment to what they do, and especially taking into consideration what their role is in the military, what branch they work for. I think I would talk to members of the Navy that have been on ship, deployed for months, so I can better understand what that experience is like and what the transition of coming home is like as well. I would definitely reach out to my past primary care physician. She was a doctor in the Navy for the last 15 years. I would ask her for some advice. I would prep myself on what the pain Jeremy is experiencing could be from, and have a list of potential causes and treatments. And then I would provide with him references of psychiatrists in and out of the military for him to talk to about his PTSD from witnessing the rape of the female member. Military members take themselves and what they do very seriously, and understanding that I think would be very beneficial in providing culturally competent health care. They tend to see things in black and white. There's rarely ever a gray area. They have sacrificed greatly to serve our country, and they appreciate support and thanks when appropriate, but they feel it is an honor to have served. They don't really want you to give them too much praise all the time. They want you to appreciate and respect what they do, but continually thanking them over and over again makes them a little bit uncomfortable, I found through my interviews. Here you can see some things I found on a website about knowledge, understanding of military culture and what it can lead to. This can be very, very beneficial, and I think that seeking out more resources like this while treating these patients would be extremely helpful. There's actually a really big network out there, even online, when you're researching this topic. If you are serving in the military field, as a medical practitioner, there are tons of websites and free online courses you can take to better understand and treat your patients. I think this is amazing and a wonderful tool that should be utilized. In sum, we can see that treating members of the military will require a full understanding of what their life is like. Understanding a better way to communicate with these men and women will make a huge difference. Showing respect from the very first interaction will make an impact, as well as having patience with the patient. I'm willing to accept your treatment plan right away. We have to understand this is a very unique situation, a very unique kind of patient. I think doing your research and approaching the whole situation with a sense of caution would be extremely fruitful in this situation. I hope you guys enjoyed my presentation. I look forward to seeing all of yours, and thank you so much for taking the time to watch mine.